Mrs. Dora van Gelder Kunz. Mrs. Dora van Gelder Kunz, April the 28th, 1904 to August the 25th, 1999, was a Dutch writer, psychic and healer, who became the president of the Theosophical Society in America. She was born at a Dutch camp called Shafica, located about 5 kilometers south of Jombang City, situated in a part of what was then the Dutch East Indies, which today is known as Java. She was raised on her father's sugarcane plantation. Dora's skills were inherited. Dora's maternal grandfather was gifted. Dora's mother was gifted. One of Dora's brothers was gifted. Dora's maternal grandmother was gifted. Her parents were also interested in Oriental philosophy and literature. They had a special room dedicated to meditation. Here the entire family sat for meditation every day. From her early childhood, she was able to see spirit beings without realizing that this was considered abnormal by the adults around her. But what is perhaps more interesting is that her family made sure she did not lose those skills. She was sent at an early age to a school where the gifts were recognized and helped. She met Fritz Kunz, and in 1927, at the age of 22, Gelder and Kunz married and moved to the United States, where she had a little boy, but used her abilities to co-develop a program with Dr. Dolores Krieger, a nursing professor at New York University, whose objective was to promote healing, relaxation, and lessen pain. Therapeutic touch is now taught in about 80 colleges and universities in the US and in more than 70 countries. We have a link in the description to an article that provides more details. Dr. Shafica Karagulla. We know more of Dora through the research of Dr. Shafica Karagulla and her book Breakthrough to Creativity. But we also have a link to a video of Dr. Karagulla with Dora in the description that is now part of the Theosophical Society in America's Classic series. Dr. Shafica Karagulla, June the 28th, 1914 to March the 12th, 1986, was born in Turkey and educated at the American University of Beirut, where she gained her MD and surgery degree in 1940. She went on to specialise in psychiatry in Scotland, where she took her residency at the Royal Edinburgh Hospital for Mental and Nervous Disorders. In 1948, she was awarded the DPM by the Royal College of Physicians of Edinburgh. In 1952, she visited the neurosurgeon Wilder Penfield at McGill University, Montreal, and later worked with Penfield on temporal lobe epilepsy. In 1956, she moved to the United States as a practicing physician and joined the faculty of the State University of New York as an assistant professor in psychiatry. She developed an interest in many ordinary people who found themselves with extraordinary abilities and spent 8 years researching them. She moved to Beverly Hills, California, and founded the Higher Sense Perception Research Foundation with her associate, Dr. Viola P. Neal. She taught courses in higher sense perception at the University College of Los Angeles. Where Dr. Karagulla is remarkable is that she had no experiences of her own to guide her. But like all the very best researchers, she forgot her own life and concentrated on the observations and evidence. Her research subjects were carefully chosen, and this is Dora. She rejected all those who claimed they had these abilities, but instead, by a laborious process of inquiry and referral, managed to find people who never boasted about their abilities, but just used them. What could Dora do? Dora could see illnesses in great detail in a patient using the energy field of the person. She could see the aura and the chakras, as well as the meridians. As you'll see from the observations, Dr. Karagulla made absolutely certain that Dora was genuine, by including a number of tests where neither she nor Dora knew the illnesses of the patients in advance. Dora was asked to describe the image she saw of the patient. There was no diagnosis because Dora was not a doctor, but she described in great detail everything she saw wrong with the energy field of the patient. She was always right. Eventually she and Dr. Karagulla co-wrote a book, The Chakras and the Human Energy Field, 1989. Diagnosing disease. Dora could diagnose disease without even seeing the face of the person or talking to them. Dr. Shafica Karagulla. Breakthrough to creativity. One afternoon I pointed out a patient in chair number 5, and Dora began to describe an abnormal condition of the pituitary gland. She found the vortex of energy in the immediate vicinity as slow in movement, followed by bursts of hyperactivity of short duration. The vortex of energy showed a grey colour, with specks and flashes of orange, which she declared was most abnormal. When she looked at the pituitary gland itself, her description was fairly detailed. Half of it looks bright, and half of it looks dull. Part of it seems dead, and hardly functioning at all. Part of it is functioning too fast. There seems to be spasmodic overstimulation. The gland may have a growth, but the energy pattern I see at the vortex tells me it is not a cancer. There is a spasmodic overstimulation, which seems to cause too much growth. The adrenal glands are affected by the pituitary. Looking further at the patient's physical condition, she said that the patient had diabetes. She was puzzled by this because she insisted that there was nothing wrong with the pancreas in this patient. Manipura, the navel chakra. She had observed a number of diabetic cases with me and had always noted that the pancreas was involved. The medical diagnosis showed acromegaly, a disease of the pituitary which causes increased size in the hands and feet. The patient had had 30 X-ray treatments of the pituitary region. He had diabetes mellitus, which is associated with a disturbance of the pituitary rather than the pancreas. Predicting disease. One has to proceed very cautiously here, as there is an effect called the nocebo effect. The nocebo effect is the opposite of the placebo effect. It describes a situation where a negative outcome occurs due to a belief that illness is caused by an intervention. It is a sometimes forgotten phenomenon in the world of medicine safety. The term nocebo comes from the Latin to harm. Dr. Shafica Karagulla. Breakthrough to Creativity. A friend of mine and her husband agreed to be guinea pigs on my program for evaluating healthy people. On the first evaluation, Dora described them both as being very healthy specimens. A year later, the husband stopped by one day and I suggested that Dora do a second examination. I had done this on a number of occasions so that I could compare evaluations of the same individual. Dora was somewhat hesitant about discussing the total picture while my friend was still present. She made notes and gave me the rest of the evaluation after he had left. She explained to me that there were certain disruptions and disturbances in the energy body which had not been present a year previous. She described this condition and said to her this meant that within a year to 18 months, my friend would have a very serious physical disorder and a serious hip condition. I had begun to realize that Dora's observations, even in predicting the onset of a disease, were pretty accurate. I discussed this with his wife. Since there was nothing we could tell him from a medical point of view, we decided not to discuss it with him. I did make a point of encouraging them both to take a trip around the world, which they had been planning for many years. Personally, I felt that in case Dora should be right, they should enjoy life while he was in good health. Within 18 months, he had developed Parkinson's disease, which has become progressively worse, and he was hospitalized for an operation due to a serious hip condition. Dora insisted that this was not precognition. The energy web or body showed the condition clearly, many months before it became apparent in the physical body. As I continued to work with Dora, she was able to repeatedly predict the onset of a disease or to indicate the progress of a disease by what she saw in the energy body or web. She always described this energy pattern as intimately related to the physical body at every point. The total structure of this energy body, which Dora and other individuals see, shows the same kind of variation as different types of physical bodies in different individuals. For example, the whole web of energy may appear to her as tightly woven or loosely woven, as coarse or fine, as dull or bright. It may extend as much as 2 inches beyond the physical body, or less than an inch. In conditions of disease, it may show a wide range of disturbances. There may be loss in the energy field, breaks in the pattern, tiny whirlpools of energy that have broken off from the normal stream, gaps in the web, or a jumble of lines of force, like scar tissue. All of these things Dora relates to conditions in the physical body, in consistent and accurate observation. Seeing the current template. Dr. Shafica Karagulla. Breakthrough to Creativity. Dora sees. She can see the physical organs of the body and any pathology or disturbance in function. She has not studied medicine or physiology, and often her descriptions are those one would expect of a layman. These descriptions are accurate and clear and easily translate into medical terms. Medical diagnosis has proved that Dora is correct and accurate in what she sees. It is the other things that Dora sees which continue to fascinate me. She observes a vital or energy body or field which substands the dense physical body, interpenetrating it like a sparkling web of light beams. This web of light frequencies is in constant movement and apparently looks somewhat like the lines of light on a television screen when a picture is not in focus. This energy body extends in and through the dense physical body, and for an inch or two beyond the body, and is a replica of the physical body. She insists that any disturbance in the physical structure itself is preceded and later accompanied by disturbances in this energy body or field. Within this energy body or pattern of frequencies, she observes 8 major vortices of force and many smaller vortices. As she describes it, energy moves in and out of these vortices, which look like spiral cones. 7 of these major vortices are directly related to the different glands of the body. She describes them as also being related to any pathology in the physical body in their general area. The spiral cones of energy that make up these vortices may be fast or slow, rhythmical or jerky. She sometimes sees breaks in the energy pattern. Each major vortex, as she describes it more minutely, is made up of a number of lesser spiral cones of energy, and each major vortex differs in the number of these spiral cones. 5 of these macro vortices are located in a line along the spine. There is one at the base of the spine, one approximately midway between the pubic bone and the navel, one at the navel, one at the level of the mid-sternum near the heart area, and one near the larynx or Adam's apple. There is another macro vortex on the left side of the body in the area of the spleen and pancreas. This one does not seem to be connected with the spinal pattern of vortices. There are 2 other macro vortices, one approximately where the eyebrows meet, and one at the top of the head. There is a 9th smaller vortex at the back of the head in the vicinity of the medulla oblongata. Dora describes the energy vortex at the base of the spine as having a direct connection with the adrenal glands. According to her description, it is made up of 4 smaller spiral cones of whirling energy, with the sharp points of the cones fitting into a center point. If there is any disturbance in this central point or core, then she looks for some pathology in the area. Breaks or disturbances in the spiral cone have to do with some function of the physical body in that area. If any of these major vortices show a dullness or irregularity or leak in this central point or core, she looks for some serious pathology in the physical body in this area. If the pattern of the cone of energy is out of rhythm or shows a break or crack, she finds that it is related to a problem of function in the area. Each of the major vortices which Dora observes has its own characteristic number of spiral cones of energy which form the total macro vortex. In each case, the major vortex, as she observes it, presents a mandala pattern. In the early experiments with Dora, I chose patients of my own with clearly confirmed medical diagnoses. Then I asked Dora to observe the patient and describe in as complete detail as possible the total physical condition. Not even the name of the patient was given to her. She described the actual physical condition, which turned out to be entirely accurate in all the cases. In addition, she described the appearance of the energy body or field and the vortices of force. In summary, Dora provides an example of a gifted person able to see and diagnose problems with the chakras, and we have a video that further describes chakras and their names, the symbolism of chakras and the flowers. It is also clear she was able to see templates and diagnose both current and future illnesses using templates, and we have a video that describes templates, the concept of the template, and Indra's net. Furthermore, she also recognised she was working with a form of energy that is still not recognised by scientists, the Prana or Ki, and we have a video that describes this energy, the symbolism of the ocean and sea. Energy medicine works at the level of the aura, not the physical body. Energy pathways, rivers and streams of energy are unblocked and balanced so that there is a continual flow of energy through the body. And we have a video on the aura, the concept of the aura and the symbol of the island, and another on rivers and streams.